Welcome to the Caregiving Podcast. I'm Inga.
And I'm Julie.
And long story short, we have Caregiving. We are two momtrepreneurs who have built an in-home care business from the ground up, guided every step of the way by God's care and fueled by agape love. Almost 14 years later, we felt called to create this podcast as a resource for families with caregiving needs. Whether you care for a family member or are looking for advice on professional caregiving, we want this to be a platform to support you.
Each week, we will come to you with encouraging stories of families who have found the right balance for their loved ones, tips for how to care for them and you, and much more. We hope you continue to join us each week as we share in this exciting new journey together.
Hello, Sunshines, and hello, Julie.
Good morning, Inga.
You're looking pretty happy today.
Oh, it's a Monday.
Is that because you haven't been to the dentist lately? I do believe at one point in life I heard you tell the dentist that you would rather go to the gynecologist than go to the dentist.
I was wondering if that would come up today with this topic.
Oh, I couldn't wait to share it.
Yeah, I'm not real sure. The gal that was on the phone was quite taken aback.
She probably laughed the rest of the day, honestly. She probably still does. She hopes for you to call back.
Oh, I just don't like to go to the dentist.
I know, and I don't know why. I'm the same way, but I don't know why.
It's the sounds and the everything.
Yeah. I've never had a truly bad experience at the dentist, honestly.
I know, and when you walk out, you're like, oh, that wasn't so bad. Then you hate it till the next time.
Right.
Huh.
Anyway.
Yeah.
Well, so when's the last time that you actually did go to the dentist?
Actually, I've been pretty good lately. I did go just a couple of months ago for a cleaning and such, but I have quite a bit of work that needs to be done. So
We're going to Mexico.
Here, there's a heck of a deal there.
I've heard that myself. All right. We'll quit messing around. Going to the verse today, Julie, you brought to us Ephesians chapter 4, verse 16. Mm-hmm. And this says, "From whom the whole body, joined and held together by every joint with which it is equipped, when each part is working properly, makes the body grow so that it builds itself up in love."
I picked that one because even teeth matter, right?
Yes.
It all works.
It's all, and actually teeth matter more than people probably realize.
That's right. As we were pulling this together, I was just like, oh, this is important. We have to talk about this.
I know.
It's one of those things that people ignore and ignore and ignore. And then I saw this verse and I was like, well, teeth are part of that.
Yeah. Yep. Got to have everything working together.
Yes.
Awesome. If you guys have a verse that you'd like to share with us, please email those to thecaregivingpodcast@gmail.com. We would love to share your favorites with the rest of our audience. So.
Yes.
And you brought to us a good news story, You Can Do It.
Well, it's actually more of a short little poem.
Oh.
And it is called You Can Do It because I, once again, hate going to the dentist.
I love all the forethought that you put into this.
I was like, you can do this. You can go. Quit being a darn baby. So giving up is easy when your dreams seem far away and life is full of obstacles. You face them every day. But no matter what the challenge, some faith will get you through. So never quit believing. Just remember, you can do it.
Oh, that's awesome. And it applies to so many things in life.
I know, but extra apply to going to the dang dentist.
Well, I came to you guys today with Hold On to Your Dreams. And again, it's kind of like you. It's not necessarily a good news story, but just some uplifting words and things that I felt were worth sharing. So for a dream comes with much business and painful effort, and a fool's voice with many words. This is Ecclesiastes chapter 5, verse 3. Foolish people talk a lot about what they want out of life, but they don't always realize that dreams take time to develop and require lots of hard work and diligence. If you have a dream or a goal for your life, and I pray that you do, then I urge you to be committed and determined not to give up. Shooting star successes rarely last, but things that develop little by little and are accomplished with hard work and patience do last. The foundation-laying years of a successful business, ministry, or life are not necessarily exciting, but they are absolutely necessary if we want something lasting. Dream big dreams. God is able to do more than we can ask, hope, dream, or think. So hold on to your dreams. Don't give up when you get weary or impatient. Endurance and steadfastness are the traits God looks for in his champions.
Nice.
Nice, huh?
Very nice.
All right, Julie. So dental health. We've we've kind of indicated that's what we're going to be talking about today, and here we are.
Yes.
Why is dental health important?
So dental health is important because of a number of factors. It can be defined as the hygiene of all of the parts of our mouth, the tongue, teeth, gums, and an internal surface of the cheeks. Never thought about that.
The whole shebang.
The whole thing. The good health of these parts has immense importance in your overall health and confidence. Good oral health translates to good overall good health, both physical and mental.
It's really, really true, though. I mean, basically, think about what confidence comes from feeling like you can smile and feel pretty or beautiful with that. Or so I know a lot of times when people are having challenges with their teeth or their mouth or whatever, it really becomes it makes you self-conscious. Right. So basically, not just for that reason, but for many reasons, that you need to take care of your dental health, and it will affect your health if you don't. And like some of the problems that it can lead to would be periodontitis, diabetes, heart disease, even osteoporosis and rheumatoid arthritis, if you can believe that.
Wow.
So we wanted to talk to you guys a little bit about things that you can do to keep your dental health in shape and some of the signs of poor dental health. So talk to me about some good dental hygiene things.
So basically, to get started, you need good dental hygiene because it can help you keep your teeth and gums healthy. Regular brushing removes plaque, which is the yellow layer of bacteria on your teeth, and makes your teeth look whiter and brighter. It also stimulates your gums to help prevent gum disease, and flossing, which I'm not good at. You are.
I'm crazy about flossing only because the spacing on my teeth is I just get stuff stuck in there all the time. So I've actually told my girls, like, when I am old and either don't remember to do this or am physically unable, they have to floss for me because I'm really hard to get along with if I've got food stuck in my teeth. Can you believe that?
No, it's actually quite irritating when you know there's something right there.
You probably, like, after lunch, I'll be like, just frantic. Where's the floss? Where's the floss? Somebody give me some floss.
Then she'll offer it to me and
you're like, no, I'm good. Thank you. So flossing I do have under control for sure.
Yes.
Yeah. So basically, in addition to brushing and flossing, also getting dental checkups. It is important because there are a lot of things that can go on in there in those tight, crammed spaces that we don't see.
Right. Oh, right. Yeah. And then you just, what I did for so long was I would take the kids to get their dental stuff done, and then I'd say, "Oh, I'll do it next time for me."
Yeah, right. Next time. It was
next time.
Yeah. Next time never came.
Yeah. And now that they're out of the house, I keep encouraging them to get their teeth checked quite often. And I have to work on myself.
Yeah. Well, it's so discouraging, I think, when you think everything's going along great, and then you go to the dentist, you get an x-ray, and they're like, you see that little dot right there? That's a cavity. Like, what?
Yeah.
What the heck?
Yeah. Yeah, and I'm not one to go looking for pain. So if I have a toothache or something, I'm like already like, oh, it's going to be a root canal, and it's going to be this and a that, and I don't even know what a root canal is, but I think they hurt, so I don't want one.
You heard that somewhere. Just gonna not do it. Well, and then so when I was growing up, I took very good care of my teeth, and my brother he wasn't as diligent as I was, but he just had different teeth, and so he didn't have problems like I did. And it would just always tick me off so bad because I would work so hard. And,
isn't that
then,
funny?
You end up with a cavity and you're like, what the heck?
Yeah.
So yeah, don't blame yourself. If you're doing the work, it can still happen.
Yes.
Mouthwash, they say mouthwash can be a good thing. I mean, there's a million products out there nowadays.
Flavors, smells.
Yep.
All of them. Just make sure you follow the directions on that.
For sure.
Yeah. Yep. So one of the things that actually happens a lot and you hear about it, is gingivitis, and that's inflammation of the gums, and that is just something that can hurt, but flossing helps. That brushing, yes. So how does it affect our health?
Well, basically, your teeth can affect it in many ways, and as the condition of your teeth worsen, they become more prone to cavities and then tooth decay. So bacteria can easily attach to them, and then it makes your teeth weaker. You're not able to chew with them properly, and it can be painful, right? And then poor condition of your teeth can also lead to other diseases. I think I had said it earlier on, but periodontitis, diabetes, heart disease, rheumatoid arthritis, lung conditions, obesity. If you cannot chew properly, you don't eat a lot of food and the requirements of your body aren't fulfilled, which makes it weaker and leads to basically a number of health risks.
Yeah, I'm thinking about that. You know, if you've got a toothache, you don't want to eat. So that's a problem.
Yeah.
That will
or maybe
affect
you only want to eat things that are like milkshakes or something you don't have to chew on or
soft stuff. So we got to take that into effect. One time in a past life when I was in the ER with when I worked there, I remember a lady coming in. This is just a horrendous story, but her dentures, she hadn't taken them out for so long. It was the worst picture ever. I mean, literally, they just had to take some pliers.
Oh, no.
And I was like, never, ever would I have known that could happen.
Oh, my gosh.
And then it just had to hurt after they finally got them out.
Well, yeah, because don't they glue them in? And then you,
but she hadn't taken them out for years and then wondered why she had a problem. And
how did they stay in?
I don't think we want to know.
Oh, man, that poor lady.
Yeah. Yeah, that had to hurt. And
very much.
I was like, from then on, I was like, oh, yeah, taking care of my teeth, way more important.
It is. It is true. So periodontitis, I believe I'm pronouncing that correctly, but that's when the bacteria stores itself on your teeth and then it increases the chance of gum infection. And basically, as your immune system senses the infection, it takes action, and then it makes your gums inflamed, right? And then that long-term inflammation and the chemicals released can actually eat away at your gums and the bones that hold your teeth in place. Yeah, it can be very bad.
Wow. Yeah, I don't think that people assume that anything here can affect anything else on their body.
And for sure.
Yeah.
And then basically with diabetes, due to a lack of insulin, the body struggles to process sugar. And so you can end up with periodontal diseases or poor oral health, making it more difficult for your body to produce and use the insulin. And if your teeth are infected and the sugar level in your blood is high, it's going to lead to growth of infection in all of the parts of your body, especially in your mouth.
Wow.
And this is really a cycle that can get out of control pretty easily.
The one that I was really interested in was heart disease. And it said, according to multiple types of research, 91% of heart patients also suffer from periodontal disease and mouth infections. 66% of those people without heart disease suffer from the periodontitis. So there's actually a real strong connection beyond similar risk factors like obesity and smoking. Inflammation of the mouth may cause inflammation in the blood vessels. That's a big deal. Yeah, this increases the chance of a heart attack in a heart patient by allowing a decreased flow of blood between the heart and the rest of the body. This also causes an increase in blood pressure.
Yeah, it's wild.
Wow.
Osteoporosis. So basically this is the disease, also leads to weakness in the bones. And some experts say that this affects more women than men and affects the long bones in the arms and the legs. Women with osteoporosis are more likely to have gum disease than women who don't. So I guess maybe it's the opposite. So maybe you have the osteoporosis first and then it causes problems, not the opposite way around, but still an impact for sure.
Right. So also arthritis patients are at a higher risk of catching periodontal diseases.
So things that you guys can do to keep your dental health in shape: stop smoking or using products that include tobacco. I know that's a big one. And if you do that, there are a lot of health things that can be affected in a positive manner, not just your teeth, but do that. Eat a balanced diet, avoid the sugary snacks, rinse your mouth after each meal, brush at least 2 times a day, make sure you're getting visits to your dentist. And, kids, do the sealant. If you can get that sealant applied, that seems to help anyway. Use mouthwash if you can, floss when you brush, use good quality toothbrush and toothpaste and toothbrushes, and then chew sugarless gums. So one thing that I've heard about toothbrushes, so they come in different, so like soft, medium, hard, or whatever.
Yes.
I've actually always heard that the medium and hard ones are very bad for you because they just tear things up.
Yeah. Oh, I have done that before where I was like, what? How in the heck did I hurt my gum? And then I looked at my toothbrush and it was very hard. I've started only using the soft ones.
Yeah.
Yeah.
You think you're doing the right thing, like, this will be better, but cause and effect, I guess. I don't know.
Right.
So what are the signs of poor dental health?
Oh boy, there's a lot of them. Yeah. Bleeding of the gums, pain in the gums, plaque or tartar buildup, tooth decay, sensitivity. Boy, I had that happen one time and I just didn't know that it was going to hit me, and I think I took a cold drink that had ice in it. Sent me up off the roof, yeah. And so I've been using that Sensodyne, and that seems to be a really good. It works for me.
That's cool.
Yeah. Loose teeth, infections that cause pain in the mouth, swelling and tenderness, receding gum line, bad breath, and poorly aligned teeth. Yeah.
Yeah. So if you are facing any of those problems, make sure you get to the dentist and get it dealt with sooner rather than later. Because I really think there's nothing in the world worse than tooth pain.
Oh boy. I had one. I was in the line at Smith's, and I had gotten the gum rub. I had gotten the bottle of extra strength Tylenol, and I don't remember what else I had. And the guy standing next to me is like, "You got a situation?" I'm like, "Yeah." And I got to get out of here because I am really cranky right now.
Yeah. I have something funny to tell you. So my niece Chloe is actually on a mission right now, and she's in Louisiana, and she says that the weather there is like living in a mouth.
Oh, you.
Isn't that funny? Oh, it's terrible, but what a great description.
Yeah. Wow, that's funny she said that.
Yeah. Okay, so back to the conclusion. Basically, to avoid problems associated with your mouth, just practice oral hygiene things.
Right.
Make your dental routine a priority, and it's going to help make you healthier, sharper, more confident. Really, truly.
Right. Yep. No, that's great. Something that I wanted to bring up real quick is actually oral hygiene is one of the things that we teach for our personal care attendants. And we do everything from watching videos, but do the teeth brushing. And we teach step by step by step. Obviously, we have the client do the work as much as they can, but there are people that we actually have to brush their teeth for them. And then, so also for those that can and then those that cannot. And the other thing we do is teach on dentures because not everybody knows how to do that.
Right.
I mean, you don't know until you have to do it, right? But there's soaks and there's scrub and everything. So just wanted to teach or tell everybody that we do teach on that.
Yes.
Because it's
happens. Interesting because as I look through some of our training things, there's 10, 11, 12 steps on these things, Oh, it was just grab the toothbrush, slap on some toothpaste, put it under the water, hope that the toothpaste doesn't fall off. Ever had that happen?
Oh, yeah. Actually, just the other day I was like, oh, is this going to make it to my mouth? It was the great.
And how do they make it look so good in the commercials where they're
curly doos when it's on top of the when it comes out of the tube onto the
I was
brush?
More so thinking, I get what you're saying. That's not what I was thinking. I was thinking about the people like on a commercial actually brushing their teeth.
Oh, goodness.
It is never that way for me.
No.
It's all over my face, down my shirt. Yeah, it's not good.
Oh, yeah. No, that's funny.
I will not be making it as a toothbrush model. Among other things, I will not be modeling.
Right. Yes, that's hilarious. So as I was researching this topic, we actually came up with some simple tricks to keep your smile shining bright for life. And so some of these things you wouldn't even think about until you had to deal with it, of course. But if you have a shoulder problem or arthritis and you're not able to brush because you can't hang on to that skinny handle, they're saying use what you have to make it bigger. One guy actually put a hole into a tennis ball. So he had a big old thing to hold. That seems a little big to me. Somebody else just used their washcloth and just made it bigger. But remember when we had our one client that actually, for all of the things that his wife was going to have to use, he got like that soft, squishy, not PVC, but something like that. Oh, yeah. Where he fitted on all like spoons and forks and knives.
It makes me think of like the pool noodles, but like smaller.
Exactly. So that what are you going to use that will be easier to grip?
Yep.
Because that's the big problem.
Yep.
Yeah.
Well, and they do say if you have an issue of bleeding gums, actually brushing longer should help with a little of this. So basically, if your gums bleed when you brush, it usually means that there's plaque buildup on the teeth and that it's inflaming the gums. Bleeding gums doesn't just mean potential tooth loss. The underlying inflammation increases your risk of health issues, including heart disease and even Alzheimer's. So to help with that, they say brush at least twice a day for at least 2 minutes. And basically floss, make sure that you're doing that and using a rinse. But
Yeah.
brush longer. Basically, if your gums are bleeding, brush longer, not shorter. Longer.
They actually said 2 minutes is usually about the time that it takes to listen to Queen's We Will Rock You. And I was going to bust out in song, but I guess I better not. And then the other one is Happy Birthday. I've heard if you sing Happy Birthday to yourself during that time.
Is that kind of like hand washing where you sing the ABCs a
Yes.
couple times or something?
Exactly.
Cool.
Yes. If the issue is receding gums, give yourself a tooth massage. If your teeth look longer than they once did, it may be partially because you're brushing too hard. People might think their teeth feel dirty. Have you ever felt that?
Yes.
Oh, what did I drink or eat?
I got a sweater
Gross.
on my teeth.
I have gotta go brush. And so they, or they haven't been to the dentist for a while, so they brush hard, which actually is counterproductive because it causes inflammation and the gums begin to recede. So use a soft bristle toothbrush like you were talking about, and imagine massaging, not scrubbing your gums.
I was just envisioning going to a massage parlor for a tooth massage. I don't know. Oh my gosh. Okay. The return of cavities, add additional fluoride, they say. So even if you survive the cavity-prone years of life, you may suddenly be finding yourself back under the drill. Nearly 1 in 5 adults 65 or older have an untreated tooth decay, and that's thanks to issues like dry mouth and receding gums. They say the answer to that is fluoride, which is an ingredient that's consistently been shown to protect against tooth decay. So fluoride is a valuable tool, not only with children, but with older adults too. Along with a fluoride toothpaste, your dentist might recommend a fluoride rinse, and those, I mean, for the most part, are available at drugstores, or you could also see about getting a high concentration prescription fluoride and just do it, apply as directed by your dentist. But that's a good little tip.
Yeah. Yep, for sure. Overcoming that sweet tooth, and then basically what they're saying is after age 50, you tend to start losing some of your taste buds. So that makes us want to crave more intense sweets, like when the kids are Halloween trick-or-treating and you want to help them eat everything. So they're just saying really just like with the kids, limit your indulgence to 1 treat per day. Because obviously the more times a day you expose teeth to sugar, the more opportunities for a bacteria feeding frenzy.
Yeah. Yeah. And then what about dry mouth? That's a thing. So the recommendation is to make like a ball player. The most common cause of dry mouth is medications, and a wide array of meds can have this effect, including but not limited to antidepressants, antihistamines, high blood pressure drugs. But basically dry mouth is more than annoying, honestly. Saliva plays a big role in reducing the risk of various tooth and gum diseases. So they say to do what baseball players do. Keep water on hand and sip regularly throughout the day, and then stock up on sugar-free gum. It helps to remove the excess food particles and promote more spit, basically.
Oh.
Yeah.
There you go. This one's gross.
It kind of all is.
I know it. I just don't like it. But this one's about bad breath, which, okay, we all have had that happen. But the way to rectify that is to clean your tongue.
Yeah, I've heard it. It's just part of the brushing process, isn't it?
Well, this one actually says add tongue scraping to your morning and night routine.
Tongue scraping? Oh, that one is gross.
Yeah. Yeah, I don't like it. And they actually they make them.
Ugh.
They're U-shaped devices that remove the gunky white layer.
Ugh.
So that's somebody with really bad breath, right?
Apparently.
Ew. I don't even want to.
Huh.
Yeah. So anyway, so add that if you are having a significant situation with your bad breath. Is your tongue gross? I mean, really stick your tongue out in the mirror. Look at it.
Does it need to be scraped?
Does it need to be scraped? But that's disgusting. But anyway, chronic bad breath can be a sign of a more serious issue, such as tooth decay. So there are reasons to look at that, as disgusting as it may be.
Yes. Well, and kind of wrapping it up on this is how often should you see the dentist? The answer to that question is there really isn't a set formula. Basically, if your oral hygiene and habits are top notch, your dentist may give you the green light to come in just once every 9 to 12 months. But if you have gum disease, diabetes, cardiovascular disease, you're probably going to need to go more often, maybe even 3 or 4 times a year. So a higher bacterial load around the teeth and plaque causes inflammation, which is detrimental when you have chronic conditions. So,
Yeah.
yeah. I think I go like once every 5 years, which is probably not recommended.
Right.
It's working so far.
Look at you.
Yeah.
Yeah, one of those things, something that we didn't touch on was if you have braces or anything. And I do know, I'm not proud, I'll just tell you. When I was little, everybody thought that I should get braces, but I was also a thumb sucker. And actually it helped because I ended up not having to have.
Because it got your teeth straightened out like they needed to be.
Evidently. So
Nice.
Go suck your thumb.
Julie has given you permission.
You got to have a soft blankie with the silky around it too.
Yes.
Yeah.
Sammy, when she was a little girl, she would suck her thumb and she had a blanket and she would call it sizzling.
Oh.
Yeah, she would just put that, and it had to be a certain type of material.
Yeah.
And she would put, and I think she called it sizzling because that's like the noise that it made.
Oh, cute.
Yeah, it was pretty
Yeah.
cute. She was pretty cute.
Oh, that's adorable. See, I'm sure I was cute too.
Yes,
But
I'm sure of it.
after quite a few years of doing this, I do think that the parents tried to get me to stop. And, they buy that stuff that you coat on. When there's a will, there's a way.
Yes. Did you just go wash your hands, or you just powered through?
I think I did. Because, yeah. But I did outgrow it. So if your kid's sucking their thumb, it's not the end of the world. Look at how I turned out.
Yes, beautifully, wonderfully. Yeah. You actually came up with a couple of grandma saying some pretty funny dental funnies.
Yes.
Take it away.
Oh, my goodness. Grandpa was getting into bed and he said to Grandma, "Did you brush your teeth yet?" She replied, "Yes. And while I was at it, I brushed yours too." Probably in the cup right next to the sink, right? Oh, and then a young child asked his grandma, "Grandma, how come when you put out your teeth at night, the tooth fairy doesn't visit you?"
That'd be an expensive one, huh?
Oh, my goodness. And lastly, life is short. Smile while you still can.
Yep. Smile while you still have teeth.
Yep.
That's awesome. Oh, goodness. Well, thanks for being with us today. And if you haven't yet, please go and subscribe. You can do that on Spotify, Google Podcasts, Apple Podcasts, YouTube, anywhere that you listen to your podcasts. And go check us out, our Facebook Care and Share group for Apaga Home Care, and leave us a review. We love the good ones.
Yep.
Send us your good news stories, your verses, your grandma sayings. You can email those to the caregivingpodcast@gmail.com. And that is it. So peace out, Girl Scouts.
Go brush your teeth. Bye-bye.